Hi guys, it is X. On today's video, we are going to be discussing why it is important to see a doctor, why it's important to see a dentist or eye doctor, every recommended time frame. So if you want to know my opinion on why you should keep up with this, please just keep on watching. But before you swipe me away or click me out of this video, please like, comment, and don't forget to hit the subscribe button. Thank you. Wanted to make this video because there have been too many times where I have been in the hospital and somebody comes in and they tell me, oh, I'm healthy as a horse, I've never been sick, and then all of a sudden they get these horrible diagnoses and it's too late. And that is why I kind of wanted to speak about this topic with you, because I find it very important to go to the dentist every 6 months, go to the doctor once a year, like you're supposed to, and go to the eye doctor once a year, because every single thing is linked. Every single one of those, whether it's your doctor, your eye doctor, your dentist, they can pinpoint something that you might not know is going on in your body and simply find a diagnosis that could be fatal before it actually happens, and they might be able to catch it early for you. So I highly recommend, if you do have insurance, to please go to the doctor yearly and get a physical. Please go see your eye doctor, and please take care of your teeth. And I'm going to explain why every single one of those things is very, very important. I'm also apologize if you hear my lisp. I do have Invisalign and it is still hard to talk. But anyway, okay, so your eye doctor. You go in yearly. You might not notice that you need glasses until you go get checked. The eye doctor also is going to take pictures of your eyes, and they can tell if you're actually having a symptom of diabetes, which is diabetic retinopathy, where these little new vasculature are growing and they're actually going to cause you to be blind. So if you don't go to the eye doctor, and this is sometimes a late stage of diabetes, so I find it very important to go to the eye doctor. And they also, I don't know exactly the mechanism of action, but I recently learned that they can actually catch myasthenia gravis early in somebody through the eye. Like I said, I don't exactly know the mechanism of action or how that's possible, but I do remember hearing that and being like, what? Like, that is odd. But yeah, that's why I recommend going to the eye doctor. And if your vision's decreasing, I mean, who doesn't want to see? Like, you have to get glasses, contacts, whether you want to get LASIK or whatever. I just highly recommend you go get your physical, please. And then for the dentist, so there are many bacteria that live in your oral cavity, whether it's strep or staph or anything like that. But I recently just saw a show of a guy who was an alcoholic. It was a medical examiner show, and he passed out, and because he passed out, his gag reflex wasn't working, and unfortunately he aspirated some of his saliva, meaning he inhaled some of his saliva. He ended up getting pneumonia, and he did not have insurance, so he ended up dying from bacterial pneumonia that could have been prevented if he would have just went to the doctor to get those antibiotics. But unfortunately for him, it was too late. And you typically don't think that. Everybody I know probably doesn't realize that you have bacteria everywhere in your body, whether it's your gut, your skin, your mouth. And depending on if those bacteria travel to a place they're not supposed to, like if the bacteria in your mouth, which in your mouth, I mean, I don't want to say it's completely safe, but like it's normally there. Your mouth is used to it being there, but you decrease it by brushing your teeth. If that goes into your lungs and causes you a pneumonia, it can be fatal. There's also something called rheumatic fever that can affect the little, what they call leaflets in your heart. So your heart has 4 chambers, and they have these little valves that open and close when your heart pumps. That bacteria can travel and stick onto those little leaflets, and it can either cause endocarditis or rheumatic fever. So it's very important to take care of your teeth, brush them properly, decrease periodontal disease by flossing. So I highly recommend you go and see a dentist every 6 months to decrease these chances of you getting these diseases that are totally preventable. Next, I want to talk why it's important to see a doctor. Everybody feels healthy Like everybody tells me in the hospital I've never been sick. Well, how do you know that if you don't go get checked? There are things that are silent that you won't realize are happening to you, like high blood pressure. How do you know if you have hypertension, which is high blood pressure, if you don't get routine screenings? Do you check? I'm sure you're not checking your blood pressure at home unless you've been told to. So if you do not go to the doctor, how would you know what your blood pressure is? Another thing is hyperlipidemia. It could be genetic, just like high blood pressure. So it can normally be high and you just don't know, and if nobody in your family talks about it or complains about it, how would you know if you have hyper high cholesterol? How would you know? You wouldn't, unless you're getting an annual exam and you're checking it. So diabetes also, I believe, people usually don't come in to see the doctor for these symptoms or think they have diabetes until it's too late. So that is one thing that I definitely think you should go see a doctor so that they can run your CBC and BMP, your normal labs, run your thyroid, whatever panel is normal. So one thing that I felt was a little controversial is that we don't catch things early enough. Like, how did we not know we had cancer? Or how did we not know that we had certain diseases? Why don't we routinely test these? And as I go through nurse practitioning school, I realized that they actually don't recommend these things for certain age groups. So there is guidelines on preventative things for your doctor or nurse practitioner or PA to check for depending on your age, height, weight, or like your social history, like whether you drink, you smoke, you use IV drugs. Like, there's just things that are in specific categories that will apply to you, that they will test that these things for you if you meet the criteria for them. So people always think like, oh wow, it's not like I'm eating chips and soda all the time, so why should I go get tested for high, cholesterol? That's not me. Well, eggs have really high cholesterol in them, and what if you eat eggs every day? Like, you just don't know. So I definitely recommend you going and getting your physical done yearly, to make sure you can prevent these things. Like, we always hear strokes and heart attacks, but the lay person does not know what a stroke or a heart attack is, and there's many different types of strokes. So I just want to make sure that you know that there are conditions out there that you can easily prevent. Like, if you have acid reflux, you are basically heartburn. If you don't treat your acid reflux, you can actually get what's called Barrett's esophagitis. Sorry, these Invisalign are driving me crazy. But anyway, you can get Barrett's esophagitis, which puts you at a high risk for esophageal cancer, because the normal lining tissue that is in your esophagus starts to change, and that is exactly how cancer is started. It is a genetic mutation from damage, and that's how it will start. So unless you are in the medical field and know these things, you wouldn't think about them. Like, I just had a conversation with one of my family members who's like, oh, I don't have high blood pressure. My blood pressure is in the 140s. And I'm like, that's stage 1 hypertension. No, that's pre-hypertension. No, like, they've changed guidelines many times, but you have high blood pressure and you're not treating it. And high blood pressure can cause heart failure, can cause an increase in your heart to pump, which eventually can cause a heart attack. It can, like, you probably have high blood pressure maybe from sleep apnea and you just don't know it. Why? Because you're not getting checked. And if you're not getting checked and then you're surprised, like, wait a minute, why did my family member die of a heart attack in their 50s? They were healthy. But were they really healthy if they'd never went to the doctor and just simply didn't know? So for the last time, my advice to you is, if you believe in vaccines, get your yearly vaccines. Make sure you're up to date. Go to your doctor. See what they recommend, and compliance. If somebody recommends something to you and the doctor's telling you, yes, you are entitled to a second opinion. Yes, you should be able to choose whether you want to do this or not. But compliance is a very big thing, Because if we're recommending something to you and you don't do it, and then something bad happens, I don't want to see you in the hospital for something that totally could have been prevented. For example, we had a patient one time who was on a blood pressure medication, but they didn't have hypertension. So they didn't understand why they were on this medication. Well, the patient happened to have heart failure. So they told the doctor, I remember the cardiologist being there, and they told the doctor, well, I don't have blood pressure issues, so I didn't see a point in taking it. Well, that medication specifically decreases the amount of workload on the heart. So it wasn't really prescribed for blood pressure, but there are some drugs have multiple reasons why we prescribe them. And even though it's not the first thing that pops up when you Google it, there's something called off-label uses. So one medication can have many different reasons. Like there is a drug called colchicine, and it is for gout. But we give it to heart patients to prevent pericarditis, inflammation of the heart sac, and or the heart. And we're like, what? Like, how does this gout medication pertain to this? However, you would never think it, but there are a lot of drugs that do that. There's also a drug called sandostatin or octreotide. We give it for GI bleeds, but it is also used to prevent hypoglycemia for patients who have sulfonylureas. So there are so many things that while we're in the hospital, we're like, why are we giving this? And you're like, oh, I had no idea that that had an off-label use, like gabapentin, for instance. Gabapentin is an anticonvulsant, meaning it treats seizures. It's to prevent seizures. However, it also is given for peripheral neuropathy in diabetic patients. So it helps with that type of pain. But you would never think that, because not everything that you Google is going to show you. So there's just some examples that if you have questions about your medications, or, you know, Google told you this so you don't think like you feel like you have to take it, please consult your doctor before you decide not to take a medication just because the internet told you it was for one thing, but you're taking it for another. It's very important to know what medication you're taking and why. Compliance is a very big thing. There's too many times where I have asked myself, like, why do patients come in diabetic ketoacidosis and you see the same patients over and over again? You would think they learn. It's the same thing with alcoholics. You ask yourself, why do they always get drunk to the point where they're, you know, in a coma? Simply either lack of education, they don't care, or they simply just don't know. So this is my video to help you understand why we do things that we do and why we recommend you going and seeing a doctor regularly. Thank you for watching. Bye.